Hi, I'm Dr. Richard Crownover. I'm a radiation oncologist here at the CHI Cancer Center in Hot Springs. The bone density changes with breast cancer treatment. The most significant ones come from estrogen suppression in the rest of the body. So that's kind of a medical oncology or drug topic. Radiation can also weaken the bones when we're treating the breast, but only in the area we treat. And so it decreases the bone strength, but it doesn't make them fragile. Somebody's not going to bump into somebody and break a rib. But if they have a car accident, if they fall down very hard, they're slightly more likely to break a rib in the area we treated than in other bones, say the ribs on the other side. It's a small effect. If you take a 50-year-old woman who is treated with breast tangents and you say, what's the lifetime risk of breaking a rib in that area? It's about 1.5%. But people break ribs anyway, so that's not all from the radiation. And if you said, well, okay, what's the risk of breaking a rib on the other side? It's about 1.2%. So you can see it's a very tiny amount, a very tiny difference. Another thing to say about bone strength, if you have someone with breast cancer who has metastases to the bones, as the tumor grows in that location, it's going to weaken the bone there. And so that can lead to something called pathologic fractures, or fractures that are just caused by the tumor. If we treat with radiation and we get rid of the tumor at that site, the bone actually gets stronger again, because as long as there's enough of a structure there as a template, the body's very clever about rebuilding the bone. So if we treat, we can actually make the bone stronger in those areas with radiation.